Recording in progress. Hello, welcome everyone. My name is Trina Becker and this is Beth Bergstrom, and we are your presenters tonight for the SpeechTherapyPD.com webinar, our EPIC Case Studies. Before we get started, we have a few items to alert you to. For CEUs, this course is 60 minutes or 0.1 ASHA CEUs. If you are joining us live, you need to make sure that you complete the course content page, including the one that says complete course before the end of today on your Speech Therapy PD account. And that's for if your state license requires live CEUs. As far as financial disclosures go, Beth and I wanted to inform you that we have intellectual property rights and receive royalty B&B SLP, Teachers Pay Teachers Store, as well as our BB Boutique SLP website. We do not have any relevant non-financial disclosures to share with you. While we're presenting, if you have questions, please feel free to put them in the chat and we will either address them as we are presenting or at the end of the course. Just to let you know a little bit about ourselves, Beth and I are both instructors in the Department of Communication Disorders and Sciences for undergraduate and graduate students at Eastern Illinois University. We teach a variety of courses there, as well as supervise clinically our students' therapy sessions and diagnostic evaluations. Now, without further ado, we are ready to present our EPIC case for this evening.
Okay, I think this is our fourth edition.
It is.
Of EPIC case studies. And tonight, our EPIC is going to be covering an AAC communicator who we are going to show you how we identified her as a functional communicator as we move through our EPIC case. So here we go on that. Okay, we have a few learning objectives for you. Learning objectives for tonight are to critically analyze the case history and other information to determine etiology or underlying factors of the symptoms that we're going to present, to develop a profile of strengths, needs, and functional impact to determine treatment priorities, and then also to determine the most effective treatment approach using client-specific values, clinical judgment, and research. Every time we do a case, we are using this same worksheet, which has been shared with you, filled out specific for this case. Our worksheet is to work you through each area of EPIC. So etiology, profile, impact, and client-specific intervention. We kind of modified this worksheet from the ICF framework that ASHA has available to us to make sure that we are considering the client as a whole as we're working toward those goals that are going to be individualized for a client. Our topic tonight, again, is AAC with a functional communicator. Our client is going to be Maddie, and she is 7 years, 6 months old at the time that we are going to be talking about her goals. And the chief complaint that we always start with our referral or as we talk to parents, the chief complaint for Maddie was her expressive language, that she wasn't able to use functional expressive language to express her wants and needs, and certainly not for anything past wants and needs. So looking at her etiology, we're starting with E of our EPIC. So etiology, we want to really take a look deeply at a case history every time. Every time we start a case, we want to really go back and look at a beginning case history. If a parent has filled out a case history previously, maybe a year prior, we want to make sure that we are having them fill out a new one so that we know the most current concerns, but we also want to dig into birth history, any medical history that happened prior to the time that we're starting with them. So Maddie has a medical and developmental history that looks like this. She has Angelman syndrome. Angelman syndrome is a rare genetic neurodevelopmental disorder that has severe developmental delays, intellectual disabilities, and also motor and speech impairments. So right away, we know a little bit about things that are going to be impacted based on her diagnosis of Angelman syndrome, and also are starting to think about prognosis and what that might mean for her in the future. All of developmental milestones for Maddie, according to the case history, were significantly delayed. Mom also noted feeding difficulties, hypotonia, deep tendon reflexes in the knees, a sleep disorder, and a history of seizures. Again, as you're reading through this, red flags are going off and you're saying what might impact her ability to use an AAC device for communication, not keep her from doing it, just challenges that we need to be aware of as we are moving forward. Other professionals are part of the case history as well. So we want to think about what other professionals have learned throughout the time that they've worked with her. She did have early intervention services, including developmental, physical, and speech therapy beginning at age 2 until the time that she aged out. She had an early childhood special education class and received occupational, physical, and speech therapy. And currently she's in a cross-categorical classroom with with speech and occupational therapy. She already has an iPad with touch chat application on her iPad that she is learning to use for communication. So once I've looked at the case history as my etiology, I want to kind of pull all that information together to form a profile of every client that I work with. So if I think about Maddie and I use her key findings from etiology to start to develop that profile, I want to make sure that I am reminding myself at all times that she has this medical diagnosis of Angelman syndrome. She has some hypotonia. She has a history of seizures, global developmental delays, and she's had all of these therapies, a long history of all of these therapies, but limited progress in each of them.
Okay, Maddie had been at our university clinic for a couple of years, but this was the assessment that we did at the beginning of the semester that we're going to refer to throughout the presentation. So at the beginning of the semester, the clinician completed the communication matrix. So this is a free assessment tool that you can use. You can look it up online. It's a free assessment tool, and it gives us information about where a client is functioning in terms of AAC use and communication overall, and gives you a way to monitor their progress. So when we did this part of the assessment, we did not use any prompts or cues or really necessarily familiar activities. It was within the first 2 sessions that we did it with her. So the clinician was very new to her. They hadn't really established a routine yet. So using that information, we determined that Maddie fell within the unconventional communication stage on the communication matrix. So that means she was primarily using gestures. So she was guiding her communication partner's hands to things that she wanted. She was looking at objects or touching them, trying to grab them, and usually using some visual referencing. So she was looking at the item she wanted in a communication partner, and that's how she primarily communicated.
And there's some real positive things in recognizing
Absolutely.
even that. That's really positive.
The stage is often associated with children approximately 12 months of age, right? So you're using those non-symbolic forms of communication to try to get your wants and needs met. We also then tried to give her a PPVT. We wanted to kind of know where she was functioning cognitively, and we thought at this point in her therapy she could handle that. So she has some attention issues and she was a little impulsive, but we were able to establish a basal and a ceiling. We got a raw score of 12, which was not very high, and a standard score of 32. Next, we did some informal assessment with Maddie, and we wanted to see how she did with some familiar activities and with some support and encouragement to use her device throughout the session. And you can see that her communication skills dramatically increased. She really relies on that context and support from her communication partner. So when encouraged to do so, she was using her AAC device to spontaneously request things. So a variety of toys, animals, some food items. She was able to put 2 words together or 2 symbols together. So she did a want and then said whatever she wanted, or want and then followed that up with a person. She likes to talk about her family. So want mom, I think, was the specific request. She was also able to say help, go, and help bathroom. So combining two symbols was an excellent skill. We were glad to see her do that. She was also labeling things as fast or slow. That was a concept that she had worked on previously in therapy. And again, with that support and with the familiar context, she was able to do that. She inconsistently protests using symbolic language. So she usually uses behavior. She'll get up from an activity. She'll try to reach for a different toy to kind of say, I'm all done, or to protest. And she'll inconsistently use it on a device, even when prompted. She really just wants to use her nonverbal communication.
So really important to do both standardized and some informal assessment.
Yeah, you can totally see the difference here. Go back one sec, sorry. Commenting, she was saying like. She was also able to use help and stop, and consistently use symbols for greetings and farewell on her device, but was able to nonverbally, so we were okay with that. Okay. This is a little snapshot of Maddie. So you can see that she is intentionally using her device. You can see that she has fairly good joint attention to the device. She needs to be directed to use it. You'll also notice that the clinician is modeling for her on the AAC device during this video. As I mentioned, Maddie likes to talk about her family. She does it sometimes to kind of distract you or to get out of, whatever she's supposed to be doing. But we were trying to make that communication about her family members relevant, intentional to the activity. So you're going to see the clinician kind of pull that in. And you're also going to see the clinician use some visuals for her 2-word requests. So let's take a look.
Marker.
Marker? What about it?
Crayon.
I don't have crayons. I have markers.
Marker.
Do you want a different color? Okay. Tell me, what color do you want?
Crayon.
I don't have any crayons. No. I'll take it. Thank you.
Crayon.
Do you want a marker? It looks like you want a marker.
Want. Marker.
What? Here, Maddie.
Paint.
No, no paint today.
Yellow.
Oh, do you want a yellow marker? Okay. I need to hear want.
Pencil.
No. No. Stop. Sit down. We have to make our turkey. We're gonna make a turkey for Mom. Ready? Let's see. Want.
Want.
Yellow.
Yellow.
You did it. Okay, you tell me want.
Like.
Oh.
Or not.
Do you like orange? Do you like orange? Yeah. Okay, I'll give you an orange one. Here you go. Good job using your talker. Uh-oh. Oh.
Help.
Do you need help?
Dad. Grandma.
Dad and Grandma? Do you want to make the turkey for Grandma? Yeah. Do you need help?
You. Help.
Oh, no, you're so strong. Uh-oh.
Mom. Grandma.
You're gonna make the turkey for Mom and Grandma? They're gonna love it.
Mom. Like.
Mom's gonna like your turkey. Let's color it for Mom.
Grandma.
Oh, and Grandma. I forgot. Grandma's gonna like
Grandma.
it too.
Like.
The turkey.
Okay. So cute. She's ornery. You can see that. Just a couple of things I want to point out about the video. We were really persistent with that two-word utterance. And I know you might be thinking, well, why didn't you just, give it to her? Because she did make a request and she did do it. But Maddie was consistently making one-word requests. So we really wanted to push her to do that two-word utterance, to encourage her to increase her utterance length. Also, how excited she got when we acknowledged her communication about her family.
We've been doing so much. We are working on some new materials and resources currently, and I'm so tuned in to her nonverbals and just showing the positives in her nonverbals to support everything else she's learning. You can see her excitement, you can see her frustration, you can see that she agrees with you. She's building her confidence because she loves that you're acknowledging her. I just love kind of seeing that in her too, knowing that I can push her a little bit because that's where she is at that current level.
And I want to praise our graduate clinician who is working with her. This is her first time working with a client who uses AAC, so she was using some excellent strategies in that video.
Yeah, she was so natural and very quick to recognize what she might need to talk about with regards to help, or again, acknowledging her saying something positive. I mean, I thought it was really, really good.
And you can tell she's practiced because she was able to quickly model on that device.
That's right.
Okay.
Okay, so the next piece of our case study, continuing with the profile, but now we want to show you a resource that we developed a few years ago, and we used this profile to determine an AAC communicator category. So we want to take all the information that we learned from standardized, from observation, from informal assessment, from case history, and we want to have multiple people kind of review her using an AAC device, and also doing some even pre-linguistic, some of those nonverbal things that we're talking about, and all come to kind of a conclusion about what communicator category the client is. The three choices at this time are emerging, functional, and generative. The AAC communicator categories, once you determine if they are emerging, functional, or generative, are going to help you to determine their goals. Taking all of those things into consideration, it really does kind of show you where their strengths are, where their needs are. You also want to consider their prognostic indicators. That's why we looked at etiology and those medical diagnostic questions, to kind of think about what those prognostic indicators are, because that'll have a big impact on her success. So taking all of that information, including it here on a profile to determine the category. Here are some of the specific pieces of that AAC profile. You're looking right now at the pre-linguistic skills that are included in the profile. Things like respond to cues, joint attention, object exploration, all the way through protesting non-symbolically and requesting non-symbolically. Maddie was independent for all of those. The three categories say not yet doing it, but only in routine situations with prompting. And then that third C column is about doing these things independently in a variety of situations. Maddie was able to show us that her pre-linguistic skills were all done independently. When I move to linguistic skills, you can see that we still have a few, especially in the functional play section, that she does independently, which is a real positive for Maddie. However, we feel like protesting symbolically and requesting symbolically still requires some prompting, which you saw in the video. You saw some visuals, you saw some modeling, you saw some questions being asked, so there were definitely some prompts that were needed. Not that she was doing that completely independently at this time. So you total up the columns and you can see that she does, let's go to the next slide first and look at prognostic indicators. These weigh more heavily than each of the items in the pre-linguistic and linguistic sections. So, we know that because of her medical diagnosis, there are cognitive issues. We also know, based on informal assessment, that she has some impulsivity. We saw during trying to administer the PPVT that she has some attention issues. Those things are going to be in that A column, but she was in the B column for social skills. a real positive for her that she only had moderate deficits in that area. Sometimes we get stuck here a little bit because you're like, man, she looked great. But if you think about her compared to same age peers, we definitely would say she still has moderate deficits in social skills. So now we can go to the summary table below and see that she had more points in the A and B column to determine between emerging and functional than she did in the generative column. But she did have some pretty good skills that are going to be good strengths for her, foundational skills for us to build on when we start writing the goals. We came to the conclusion that she was a functional communicator because she does show us symbolic communication. So, pretty good. So we are definitely going to determine that she is a functional communicator, meaning that she relies on contexts, prompts, and or routines to communicate. She has the ability to acquire early language skills like requesting, protesting, answering concrete questions, greetings, concrete feelings, and simple conversations. We feel like she has the ability to do this. Probably, I think we're going to move to see if she's beginner, intermediate, or proficient or advanced. So we'll take a look at that in just a second. So right now, just determining her communicator category as functional. Okay, this is the part of our EPIC profile where I like to ask some questions. So if you look at your worksheet that you have provided, you'll see that going across underneath impact, we're going to ask, is this area impacting Maddie in any way, shape, or form? So does Maddie have difficulty with auditory comprehension?
Absolutely.
Okay, and you feel like that's something we need to focus on?
I think that's something that we need to focus on or is a consideration when thinking about goals.
Okay. How about oral expression?
Definitely.
Okay. EF cognitive.
Yes, she has deficits in both cognition, and her EFs impact her ability to pay attention, her ability to stay engaged in the activities. Her impulsivity impacts her success with her device, and she wants to kind of just quickly, touch a symbol, maybe without thinking about it. So yeah, that's an impact.
Okay. Speech.
Speech, yes, it's impacted. She's not using speech very effectively. She doesn't have hardly any words, which means she needs her AAC and she needs to use it.
Social.
Yes, I know she's social. I know she wants to engage. You can see her trying to engage with her clinician, but her lack of expressive communication impacts her socially with her peers.
Yes.
She has difficulty because she's not competent yet with her AAC device, initiating play with her peers, being able to chat during that time with her peers. So yes, it's a definite impact area.
Okay. How about behavior?
Behavior, yes, she has some. We talked about her EF, and you
Okay.
saw her kind of wind up to hit the clinician.
Get
So
frustrated. Yeah.
there are some behavior concerns when, her nonverbal communication is not effective. She uses behavior. So we need to work on that and shape that.
Okay. Sensory.
Sensory, Maddie doesn't have a lot of sensory issues that we've identified. So
All right.
not a big area of concern.
How about written expression?
Based on her academic level, she's not working significantly on written expression at this point. I mean, they're introducing the alphabet and those kind of things. So it's not really a consideration right now for her that I'm going to think about in this semester or in this current time for her goals.
Okay. And then same reading comprehension?
Yeah, same.
Okay. All right. So not a concern at this moment. Okay. Thinking about the client as a whole, that's what those questions are doing. I need to consider all of those areas. Now I ask some more specific questions. So what impairments most impact her daily function?
Her ability to express herself.
Okay.
Yeah, her expressive communication.
All right. What activities are most important for Maddie?
She just needs to functionally be able to communicate. Her mom talks about how, it's difficult to sometimes know what Maddie wants. It's hard to figure out why she's upset when she gets upset sometimes. The classroom, the teachers mentioned that she has a hard time answering questions and participating activities because, again, she goes to her nonverbal or non-symbolic communication, and you can only say so many things with that. So really, it's that functional communication that she needs to participate in her environments.
Right. Okay. How about what current characteristics hinder Maddie the most right now?
Attention,
Okay.
impulsivity, and how much she relies on prompts and routine activities to independently use her device or to initiate use of her device. Do you remember back to the assessment, when we did the communication matrix and did not provide any supports, didn't direct her to use her device or encourage her, she didn't use it at all. So
Right.
I think that's an obstacle for her.
Definitely. Okay. What current characteristics are strengths that you're going to use to build on?
Her social motivation. She loves to interact with people. You could see how happy she got, when the clinician was talking directly to her and acknowledging things that she was saying. She has some pretty good play skills. Maddie loves pretend play. She loves to socially interact with others. And I think that is a motivating factor for her to want to learn to use her device or to use it more. Her receptive skills are higher than expressive.
Okay.
So she's got a good foundation, receptive knowledge. I know we said that was an area of concern because it's obviously not even close to her age range, but it's still higher than expressive. So I think that's a strength for her. And her attempts to use her nonverbal.
Love it.
I've talked about that as a weakness, but I think it's also a strength. Because when a child uses AAC, we want them to use as many modalities as possible. So if she can start to pair more specific information with her nonverbals and non-symbolic communication, that's going to enhance overall.
And if everyone recognizes those things as communication attempts, she's going to, again, be more willing to participate, be more motivated to keep working through some difficult things. So I think those are all definitely things that you need to consider as you start to plan goals. So you can see how asking these questions make you think about the entire client from beginning, from A to Z. And it's going to show you or pinpoint the things that you need to highlight in your goals.
And even though Maddie has obviously concerns across several areas, as we think about goals, we have to pick and choose. We can't target everything, right? We can't target everything all the time. So that's also why we need to think about what's the impact? What do we need to focus on the most right now that's going to impact Maddie's ability to communicate?
Yes.
Okay, so we know about where she's functioning. We have a good idea of her profile, right? We've determined that she's a functional communicator, and that gives us kind of a continuum of where we're going to go with Maddie. What's her potential with AAC? We know that she has potential to learn to request. We know she has potential to learn to answer questions and ask questions, use some carrier phrases, combine some symbols, and potential for some social language. With that in mind now, we need to start thinking about what are the specific goals we're going to write and what's going to guide our thinking about goals or our development about goals. So I always like to go to the good old Janice Light article and talk about communicative competency. So when we think about Maddie and where we want her to go, we want her to be able to communicate with her device and as many of her nonverbal communication strategies as she can. We want her to be able to communicate wherever she is, to whoever she's talking to, about whatever she wants. I mean, that's, independence, right? Communication independence. And to do that and to make a well-rounded communicator with her AAC device, we have to think about the 4 competency areas of operational, strategic, linguistic, and social. Of course, we're going to focus on the language skills. I feel like that's the SLP's go-to, right? We always think about the language skills, and that's pretty easy for us to develop goals in that area. The social, I don't know about you, but I feel like sometimes that's a forgotten piece, but it's so important for communication. So thinking about that as its own competency area, I really think is important to make sure that we're addressing the social language so that these AAC communicators, and Maddie specifically, who we're talking about tonight, can increase her social connection and social closeness with others.
Which is a strength of hers and something that is going to motivate her. So we
Right.
don't want to not focus on those goals.
No, and isn't that what communication is about?
Yeah, social closeness, right?
Right. We can't forget about operational skills. We have to make sure that Maddie has the skills it takes to find symbols that she wants to use, to do the operational things on the device that she is able to. We also want to think about strategic competency to address those communication breakdowns. If we don't address strategic competency and clients continue to have communication breakdowns, you're going to see them not want to use their device. It could result in abandonment. They're going to be frustrated. And so we have to think about, okay, well, we know with AAC, it's very likely that kids are going to have communication breakdowns with their communication partners. They have to be able to recognize those breakdowns and know what to do about them. And so that's an important area for goals. So I like to think about those 4 areas as I'm considering goals for an AAC client. And I usually make my students, okay, let's think about operational. Is there anything we need to address there? Let's think about strategic, right? To always go through those 4 areas. You may not all the time have a goal in every single area.
Okay, that's a good point.
But they should be considered every time.
Good.
The next resource or framework that we use when thinking about goals is the Guide to AAC Communicator Goals. So this was a resource we developed a few years ago as well that provides a continuum of goals from a beginning level to advanced for both functional and generative communicators. So for Maddie's level, specifically, we're going to look at that and see where she falls within those levels. We have specific goals in a continuum for linguistic and social. So what are the foundational linguistic and social skills they need, and then moving all the way up to advanced. And then we also have a checklist of operational and strategic competency goals to consider to help you generate those goals. So let's take a look at that. Oh, not yet. I'll get there.
A couple more things.
Let's talk about vocabulary. That's hard, right?
Yeah.
It's
How
hard.
do you choose what words are important for a client to have? And it's going to be different for every single client.
Right.
But there are a few basic frameworks that you need to consider.
Yeah. And in the world of AAC, I'm sure if you've worked in that very long, you've heard about core vocabulary. And everybody has been preaching for the last few years, core, core, core. And I think in that, I think they forgot a little bit about how important fringe vocabulary was.
Especially.
Love this article, this Lobsher, I think that's how you say the name, Lobsher, whatever, not sure, and Light in 2020. This article discusses the importance of thinking about core and fringe and how important it is to balance both, and especially for early language development. It really emphasized the importance of those specific nouns for those early language learners. Those are going to be the words that they're motivated by, because that's what their books are about. That's what their toys are focused on. That's what their TV shows are talking about. That's what their classroom, maybe thematic vocabulary is talking about. So we can't forget about that, and we need to consider it. Also, we used a resource, More Than Words. This is a presentation we did at the Speech and Hearing Convention for Illinois in 2023, and it compiled vocabulary suggestions based on word lists from research, where a child is in development, and the communication priorities. So we have that to show you too.
Yeah, there's a lot to think about before you just start jotting down goals.
Absolutely. Okay, this is what the Guide to AAC Communicator Goals look like. Do you want to walk through this?
Go right ahead.
Okay. I've been talking for a while. Linguistic and social goals. If you see that one with the yellow, it kind of shows you how the continuum is set up. So there's a snapshot of beginning and intermediate goals for a functional communicator. So you can see linguistic and social. In the yellow is the description of what a beginning communicator should be able to do. And then to the right, linguistic and social are the goals you'll write to get them to that next level of intermediate. This is not an all-encompassing, list. You should also think about your clinical judgment, where your client falls, and what their needs are. So this resource provides a list like this for emerging communicators, functional communicators, and generative. And then you also on this page have a snapshot of operational goals And those are divided in between access, skills that you need to operate the device, and skills for navigation and message retrieval. So we feel like that covers all of the operational skills that you need to consider. And then the strategic goals looks at both preventative and repair strategies. So that's the how can we prevent it? What are some strategies we can teach our children, AAC communicators, to use? And then how can they repair?
So now you've got all four of the categories. You've got some examples here of all four categories, right? Linguistic, social, operational, and strategic. So you would kind of look through this goals guideline and try to identify appropriate goals based on your client's profile.
Okay, so Maddie has achieved all the goals in the beginning communicator category. So if you look at a beginner, the description, a beginner is one who would understand cause and effect. They're making meaningful choices. They're communicating purposefully. They're using a few symbols. They're requesting a little bit, and they may have some deficits still in some pre-linguistic skills. So we did this earlier on with Maddie. She worked on the following linguistic and social goals that are up there that say achieved, and got her to the point where she is now using minimally 20 core and fringe words. And she's using a variety of requests. So she can request an object, she can request an action, she can ask for help. She's protesting. She still needs some support to be able to do that, of course, within her context or some prompting. And she's using routine greetings. So all the areas in intermediate are checked. So I would say that Maddie is an intermediate functional communicator right now. So then goals we're going to consider for her then are in the next two columns. So the linguistic goals are, social goals are in the white.
Okay.
Next, thinking about vocabulary for functional communicators, as I talked about before, that one resource, that one presentation, we kind of put everything together about what development tells us, what the research-based word lists tell us, and what she needs to target those communication goals that we just mentioned are appropriate for her. So language development, keep in mind that our functional communicators are not typically communicating in lengthy sentences. So we're thinking about language development, maybe up to 4 years old for them. Development tells us that they need all parts of speech, really, nouns and verbs and descriptors and quantifiers. We're going to keep them kind of at that early language level with that vocabulary, but they need a variety of all of those words. Our research word lists, so when they did inventories of typically developing toddlers, typically developing preschoolers, these are a list of the core words that those individuals use the most frequently in their environment. So you can see some pronouns there, you can see some verbs there, you can see some comments, some likes, greetings, prepositions, and some WH questions. And then as far as the goals, what are we going to target with Maddie? The communication goals are going to focus on requesting, protesting, expanding utterance length, answering questions, asking questions, and commenting. And so that further justifies the need for a variety of verbs on her device. She needs some descriptor words, WH question words, and feelings. She also needs some comments. So you can see everything is kind of lining up in terms of what we need for her, thinking about development, what children are using at that age, and what she needs for communication goals.
At this point, I feel like a lot of people always ask us questions about how did you decide which device or application to use for a client? And do things like vocabulary impact your decision? Or is it more about the setup of the device? Or is it more what's available to the client? Do you recall specifically about how Maddie arrived at her touch chat application?
I was not her supervisor
Yeah.
at that time. She had her touch chat when she became my client.
Okay. So how do you make that application work based on vocabulary that you decide is needed for her? I mean, I feel like every device can be,
Yeah.
designed or is designed to work. You just have to know where things are.
Yes.
And how to teach that. Okay.
Yeah, because I think if you think about some of the popular applications, and I know you've had clients that have had Prolo Quote Go
Mhm.
or have had the LAMP, Words for Life. Like core vocabulary may be a focus of those, but they also have places where you can insert some of that fringe.
Right.
So like you said, it's all about figuring out where am I going to put it on the device. And you've had some recent experience, right, with parents kind of doing a lot of customization.
Right. So that was going to be my next question is whose decision is it?
I was reading your mind.
I know, we always do. Whose decision is it on where fringe vocabulary goes? We've got now some gestalt language processors who are using devices where maybe we need some more phrase base. Who decides? There's not just one right answer. Who decides?
I think it's a team.
It's a team. We're going to move on here shortly and talk about some education. And I think that's going to be a big piece of our education is talking about customization, personalization. When is that okay? When do we need to be, more cautious about that? It's a team decision, and everybody needs to be on the same page. That's the bottom line.
Yeah. And I think the primary or the person who knows the device the best, which is typically the SLP, needs to be the primary decision maker of where that vocabulary goes. Like you need the input from the team. You need to know from the teachers what words are really important for you, for the child to use in the classroom, and from the parents.
Yes.
What words are really important? And then you're going to help guide their thinking about where they might go because organization is a very important thing. I mean, we've both had clients where people start programming willy-nilly and then the device is an absolute disaster.
Yes,
And
I'm sure you're all shaking your heads right now that you've had that experience. And it's one of those things that makes abandonment kind of, a potential problem because everyone is so confused and they just kind of throw their hands up and they're like, I don't know.
Right.
So really from the beginning, accepting what maybe decisions were made and making it work as a team. Again, the bottom line is everyone needs to be on the same page, and stick to it.
Yeah.
Right.
And I think with devices nowadays, like you're not programming as much as you were 15 years ago because the devices are so research-based now. They are thinking about the organization of the pages. So now your job is really to think about when I add something, where does it go?
Right.
And you have to understand the organization of the device. Like if you're working with LAMP, or if you're working with a PRC device, that organization is way different than TouchTap.
Yeah.
So
lots of things to think about around vocabulary. I feel like that's kind of a vocabulary issue. So I think that's important to think about that.
And we've had parents when you're trying to educate them and you're like, oh, you need to model for your child. And they're like, I can't find anything on that system. It's usually because people have started programming things wherever they want.
And sometimes our clients are being seen by multiple SLPs. So then, I mean, hopefully there's good collaboration, but sometimes there might be a little bit of pushback by saying the SLP, at school wanted to do this. And all of that is fine as long as we communicate. And we all know kind of what the thought process is and come to a conclusion.
Definitely. Okay, so here are the goals that we arrived at for Maddie that are very client specific. So receptively, we've got we need to think about what is Maddie going to be expected to use expressively next? Well, probably some descriptors and action verbs to be able to answer those WH what doing questions. So we're going to work on some concepts. We're going to work on some action verbs for her to receptively identify. And then expressively, we're going to expand her use of two-word utterances through carrier phrases, answering some questions to start to really focus on that who and what doing questions. Those were important for teachers to be able to, for her to be able to demonstrate her knowledge in the classroom. She's got to be able to answer some questions. We want to hit at that social piece and get Maddie commenting and expressing herself. So being able to say yay or fun or I like this or I don't is really important for her. Greetings with peers and teachers. So again, we said we don't necessarily care if she waves or she says hi on her device, but we want to expand it to less, not just us, but less familiar. Well, they're still familiar. Peers and communication partner, peers and teachers, but we want to expand her use of greetings to them to intentionally work on that. And then operational and strategic. Operationally, I want her to be able to navigate to high frequency vocabulary independently. The words she's going to use often, I don't want to have to help her to find those, right? So we want to increase that independence so she can become as independent as possible. And then strategically, you guys saw Maddie, try to use a lot of her non-symbolic communication strategies. And then on her assessment, you saw how much lower functioning she was when only using non-symbolic. I want her to realize that she may need to use a communication repair strategy by using the device when those non-symbolic forms of communication are not effective. So when she does a gesture or does a facial expression and she's trying to say something, she needs to recognize, oh, my communication partner didn't understand what I want. I know I can go to the device now and explain that to them.
And to make her less dependent on you saying, we don't understand.
Absolutely.
So, I mean, I think that goal takes quite a while. And it needs to be addressed in multiple places with multiple people to really kind of get that point across. So again, you can see that these goals are in the 4 areas of communication competence. And also these goals, really the beginning, the basics of these goals are coming right from a guide to goals.
Okay, intervention. What are we going to do to teach her these skills? If you've been in the world of AAC very long, you know about aided language modeling.
It's my favorite.
It's tried and true, right?
It is, yeah.
So the article,
so easy to teach.
Oh, so easy to teach. And everybody needs to do it. Go ahead.
Nope, I just said love it.
Love it. Biggs, Carter, Gilson in 2018, they did a systematic review of the research of ALM. So we put that resource there for you because that is a good evidence-based article. And in that article, they described and found that aided language modeling was good for teaching receptive language. It was a good way to recast and build utterances, teach vocabulary, and then aided language modeling can also serve as a prompt for communication. So like if you're using it, then it's the child's turn. So they found that it could be used for those things. And you're going to talk about that more when we talk about parent education.
I will.
Milieu teaching approaches. So this is a tried and true also teaching intervention for early communicators. So you may use things like incidental teaching, using some time delay or expectant delay with the client and Maddie specifically to increase initiation. So that would be expanding wait time, letting her know, in nonverbals that you're expecting her to communicate. And I will tell you the power of wait time is huge.
And it's one of the hardest things. So aided language modeling, easiest, we love it. Wait time is difficult because we're all SLPs and we want to talk over everyone else.
I don't know about you, but I've been so surprised sometimes when I stop talking.
What happens?
In a therapy session.
Yeah, what happens?
And how they're like, oh, I need to say something. And sometimes you get some social things that you don't expect. It doesn't always have to be about answering a question. I feel like sometimes AAC communicators feel like all they do with their device is answer questions.
Absolutely.
So that's huge. And then finally, using the manned model technique, and all of these things should be occurring in natural environment, right? So these early communication skills, the best way to teach them is in their natural environment. We want to do it during play-based activities. We want to follow the child's lead. So that they're motivated to communicate and we can expand on things that they're interested in. And then finally, we need to be thinking about visuals. So using visual prompts, using video modeling. We have lots of research to support those strategies for language development for AAC communicators, but also verbal communicators. And then as you saw in the video, we were using visual prompts already with Maddie. So using some sentence strips. So she had that visual prompt of want, the want symbol plus another one to let her know this is our expectation. That helps, them become less reliant on verbal.
Right.
If you can use those visual strategies.
And those visual strategies are also good for to share with the school, to share with parents. So don't be afraid to share some of those visuals with others, so that they can be, again, less prompt dependent in multiple places.
And consistent.
And consistent. Yeah, if you find one that works, don't you want to share it with others?
Yeah.
And if you find one that works, share it with us. Okay, a little bit more on client-specific intervention specific to AAC, specific to lots of things, but it's just there's nothing more important than parent education if you have a child with an AAC device. You never want a parent to feel like they are working alone with an AAC device. They're not the experts. They're the experts in their child,
Yes.
but not the experts in how to use a communication device. You are. So the most important thing is to keep in mind that no one should be working on their own. So, we have another resource that we created called the Alliance, and kind of the idea behind it is, less just me working on this, but I need more everyone. So less me, more we. How do we get everyone involved in this whole education piece for using the device for the child? The ultimate goal is for the child to be successful and to use this with multiple people, not just use it for themselves, not just use it with the SLP, not just use it at home, during mealtime. That's not the point. So some of the resources that we kind of came up with for thinking about forming an alliance between everyone that's working with the client is, first off, asking people what's important to them. We developed surveys for parents, for other caregivers, for classroom teachers, and we said, what's the most important skill that you really want your child or student to be able to do? And when is this actually going to be feasible to be able to do it? Is there a time of day that this is going to be feasible? So importance, feasibility, what do we want to do? So we have classroom teacher surveys. We also have parent surveys. We want to know. And also we want them to know that we want their input.
Yep.
So I think once you hand that survey over and you say, you tell me what activity is important and what activity is feasible, and I'm going to try to develop some activities for you to practice that activity or to incorporate the device into that activity in the classroom. Once you ask them what they want, you're going to have some buy-in to what you're trying to do. So really important to do the surveys. After you do the surveys, we like to kind of set priorities and put everything in writing. We want to have those priorities and that information before we settle on like IEP goals for the year. We want to make sure that we're addressing all of the concerns. Once we do that, we want to check in. We want to check in to say with parents, what kinds of things have been working, what's not working, with the classroom teacher, what's been working. Did you think of a better time that we might be able to incorporate this device? We want to make sure that we have some correspondence, and we have some forms just already done for you so that you can just kind of, update those without having to take up too much time. But I also feel like don't be afraid to take up some time.
Yeah.
We really, maybe on your caseload, you only have, I have no idea. Maybe you only have 3 kids with AAC that you're going to have to put in some of that extra time with the correspondence. Make sure that you're setting aside the time to do that. You need to check in. So overall, too, with regards to education, you want to make sure that everyone is aware of what the goals are. So parents need to know what goals were determined. Classroom teacher needs to know what the goals are. If there's 2 SLPs, everyone needs to be aware of the collective goals and the priorities that we have set across all of the different settings. And then you want to think about creating opportunities. Creating opportunities is a great strategy for parents to kind of think about and be taught and have a discussion about. And that is kind of, again, part of this feasibility issue on the survey. When is it feasible to work on requesting?
I think that's been a big thing with parents, making sure that your suggestions for them are individualized.
Yes.
We've heard many years ago, we did a boot camp, and I think that was really important to the families, and that stood out to us, that they want individualized plans, which makes sense for how it's going to fit in with their life, their family, and for their kids. So Be careful about giving some really generic recommendations for families because they could get frustrated if that's not a good time for them, or that doesn't work for them, or that's not a priority for them.
And once you ask, you need to be accountable to what their answers were. So, listen and apply them, acknowledge them. And then you will be the one, though, who has to give them the activities to practice in. Again, you're kind of the expert in, here are some activities. You told me this was important vocabulary. You told me this was an important time to work on this, but I am going to provide you some suggestions of activities to do. Some parents just don't quite know how to incorporate those things into an activity, and you do know how to do that. And then finally, you want to make sure that you are offering teaching to the families and that you are modeling for them. We talked today about, possibly, requiring people to take some videos of what they're doing in their sessions and sharing them with families, especially if you have a client with AAC, so they can see that in practice, because it's very different than putting it on paper or just telling them about it. So don't be afraid to do some video sharing. And then I wanted to make one comment on aided language modeling. We again mentioned that we did a boot camp several years ago, and we taught parents aided language modeling. One of the mantras that we had is, you need to know the device as well as your child. If you don't know the device, then you're not going to know how to respond, how to model, how to ask questions. So we think that aided language modeling, all modeling, is just so important. Also, we learned that kids love seeing their family members use their mode of communication. When they saw their parents using the device, their eyes lit up and they kind of looked at us like, did you see that? Can you believe my mom knows how to, find that word on my device? So teaching and modeling, if you have to pick just one thing to educate family members on, make it aided language modeling, because it will force them to find icons, to find vocabulary on the device, and then use it to ask a question or use it to make a comment. Sometimes it takes them a very long time, and that's okay. They get faster. So it's one of the most important things that we can teach our families. If we do not include caregivers in the process, we will lose our AAC users. They must be educated, and we know that that's a very difficult thing for you to do if you're in the school and don't have access, but you have to find a way. And we do have some resources available to you to maybe hopefully make that easier. So, check them out, see if it's anything that you would like to use or adapt for yourself.
There are also some great videos on YouTube. I know I've searched and shared some with families before on aided language modeling, creating communication opportunities. So you can quickly search those up and stick them in an email and send them to the parent. So then you don't have to take the time necessarily to do that education.
Okay, we're at a point where we could take a couple of questions if anyone has any questions. Otherwise, we'll maybe think of a few more things that we wanted to highlight before our hour is up. But we also wanted to show you kind of where you can find us on social media. You can look these things up. We do have some questions, so let's try to respond to a few. Hi in San Diego. We are in Florida right now on a little vacation, just the two of us.
Let's see. Oh, sorry. I'm not doing a very good job scrolling. Go ahead.
Let's see. Oh gosh, why am I not either? Would we get a copy of this resource, or is it on the course materials? Because you have the handout. You don't have the PowerPoint, but you have the handout that should have the information that you need.
And where to find the resources, those should be on there too.
Yes. And individualized goals, just some general comments on some individualized goals. Again, we have kind of the resource that has goals, but based on whether it's survey questions or based on informal observation, then I think you can make those more individualized to the client, right?
Yeah. Oh, yeah. Is that about the parent individualized in what way? Yes, they want to know. So here's a good example. I feel like when I was early on working with AAC communicators, snack time was very motivating to clients during my therapy session. So I would recommend to families like, oh, during mealtime, during breakfast or during dinner, why don't you have the AAC device out and have the child request things? Well, that wasn't always the best time for families, because dinner can actually be hectic time as as parents are trying to get dinner on the table. You're trying to get everybody fed before they're off doing their other activities for the evening. So when I would give that suggestion to parents and then they would fail because they didn't have the time during that time or they were extra stressed, like that was not an individualized recommendation for them, and therefore it wasn't successful, and therefore it made the family very frustrated that they weren't able to do it, felt like they were failing, and then, they weren't benefiting their child. So I think that's really crucial, to ask family input about when do you think is a good time to integrate the device? Is it during a book at night before they go to bed? Is it during, when you're playing a game with them? Is that an opportunity? If you don't have time, does big sister have time to do that with, the child? So that's what we mean by individualizing.
As someone said, at what point do you make it individualized, after or before building rapport?
As soon as possible.
I think as soon as possible too, but I love the point of making a connection and building rapport first, and maybe even make sure that you take some time to build some rapport with parents.
Yeah.
So that you can get the best information about what they need. And again, I think a lot of the individualization is probably going to come from the vocabulary that you choose. And so I think, doing some of those inventories and the surveys to find out kind of what things they need to be talking about. Maddie was in second grade at this time. And so those are definitely things that you want to consider. Maybe go sit in the classroom so that you can kind of see what kinds of things they're working on or what the expectations are for them in the classroom. And that will help you with some of those individualized goals.
Yeah. And as Beth mentioned earlier about, getting permission to video and send videos home to family of you working with their children, that can be great ways for them to understand what you mean by aided language modeling or giving a wait time. And that can be a great way to, if they said they want to try it during a book, for you to show them how that might work in a book. People learn from watching others do it, right? So if you can be that model for them, I think that's even more beneficial. For teachers who we need to get on board as well, I think going into their classroom and doing it in that moment and that activity that they recommend is also very important.
And struggle with it. It's okay to struggle with it too,
Yeah.
and then have a discussion about why it was difficult. That's really important as well. Before we click off here, it is 8:02. We want to make sure that you know that this guide to AAC communicator goals, people have been asking where we might be able to find the flow chart of the goals. That is in B&B Teachers Pay Teachers store. You can find our guide to AAC communicator goals as well as the profile. Okay, I think we are probably done for tonight. Did you want to add, was there one more question?
What do home activities with AAC look like? Are there written? Do we write them out for them?
We have some handouts called some parent education things called WISPs that you could have a topic like aided language modeling. It tells you why it's important, how it's important, and then give some examples of how you might do it at home with the client. So you can also find those on our B&B Teachers Pay Teachers. Those are called WISPs.
And I would say that what they need to look like is what's going to work with that family. And I think including activities of daily living and AAC into that is also really, really important. So into their regular routines, bedtime.
And I definitely think written is really important, if not written and a video of you doing that activity with them.
Yes, absolutely.
All right, it has been fun. We will type in, someone asked WISP, we're going to type in here for you what that is and how you can find it. And you guys, thanks so much for joining us. We'll be back next month, the last Tuesday of June, to talk about AAC again, but we're going to talk about a functional communicator who is a Gestalt language processor. So things will look a little bit different. So join us then. We'll see you. Oh, hold on.
Okay.
We have something to read.
For just to remind you about your CEUs. If you are joining us for the live portion of the course and your state licensure requires live CEUs, be sure to complete all the sections of the course content page, including the one that says complete course, before the end of today. So get off and do it tonight. And you can find that on your SpeechTherapyPD account. As Beth said, we look forward to seeing you. Hopefully next month you can join us, and we're going to be talking about AAC again, and we're super excited to talk about a GLP AAC communicator. We're really digging into that stuff right now, and so hopefully we'll have some good stuff for you to share. Good stuff to share with you.
Thanks for joining us.
Thank you for joining us for today's live course. In order to receive live credit, you must complete the full course, including the quiz and survey, the same day as the live presentation. Now that you've enjoyed the presentation, please go back to your dashboard when logged into your account and scroll down to find your enrolled courses. Once you locate your course, click on the course box to open the course content. Once you open the course box, the webinar information will appear. Simply click OK to move on to complete the course. Please keep in mind that you must access all modules in order from top to bottom as noted in all course instructions. Start with the course instructions and work your way down. You must access any provided handouts in order. Simply click the red box to download the handout to your device. The handout will then be located in your download section of the device you are using. Once you have accessed any provided handouts, you can then go on to the quiz. Keep in mind that a quiz may be 2 simple questions for you to answer or verify attendance. If the quiz is this type, click inside the gray box to input your answer and then follow the steps to proceed until the quiz is completed. Once you have completed the quiz, you may then go on to the survey. Complete the full survey and then you will receive your certificate of completion. Please note that if you wish for your completed course to be sent to ASHA, you must have selected yes for the ASHA registry and also entered in your full ASHA number within your account at the time of course completion. Then please allow 1 to 2 months to show on your ASHA registry. Thanks again for joining us for today's live course. Thank you for joining us for today's live course. In order to receive live credit, you must complete the full course, including the quiz and survey, the same day as the live presentation. Now that you've enjoyed the presentation, please go back to your dashboard when logged into your account and scroll down to find your enrolled courses. Once you locate your course, click on the course box to open the course content. Once you open the course box, the webinar information will appear. Simply click OK to move on to complete the course. Please keep in mind that you must access all modules in order from top to bottom as noted in all course instructions. Start with the course instructions and work your way down. You must access any provided handouts in order. Simply click the red box to download the handout to your device. The handout will then be located in your download section of the device you are using. Once you have accessed any provided handouts, you can then go on to the quiz. Keep in mind that a quiz may be 2 simple questions for you to answer or verify attendance. If the quiz is this type, click inside the gray box to input your answer and then follow the steps to proceed until the quiz is completed. Once you have completed the quiz, you may then go on to the survey. Complete the full survey and then you will receive your certificate of completion. Please note that if you wish for your completed course to be sent to ASHA, you must have selected yes for the ASHA registry and also entered in your full ASHA number within your account at the time of course completion. Then please allow 1 to 2 months to show on your ASHA registry. Thanks again for joining us for today's live course.